Well, welcome back to another episode of Sports Medicine on Tap. My name is Brandon Alliant. We're here at Neck of the Woods Brewing Company in Pittman, New Jersey, with an extremely full table of awesome guests for our big episode number 100. Dr. Frey, we made it. Well,
100.
You, sir, made it. I'm only like 45 in. You're a century man. You made it 100 rounds.
I've been here for 100. I can't believe I've been here for 100.
100 hours of you talking about all kinds of stuff.
Nonsense. People are still listening. How did that happen?
I don't know, but hey. We gained a following. We have an audience. We have fans. We have supporters, and we're super appreciative of that, of everyone who follows us on Instagram, YouTube, and all the different things like that. We're super happy to have everyone who supports us. Like I said, Neck of the Woods Brewing Company. Don't forget, folks, we're going to put this little blip in early. Sourfest is May 18th this year. Okay. It is less than 3 weeks away. We're right around the corner.
Less than 3 weeks away, right there.
About 2.5 weeks, and when the show comes out, it'll be about 2 weeks out. Mm-hmm. And we brought a bunch of different guests, some familiar faces, some new faces.
And then maybe someone swapping in a little later.
Yeah, we might have a little early exit, late entry. You know,
right.
We're going to have all kinds of different things.
Yeah.
We figured we'd go a little big for episode 100.
Yeah. Bringing some of the familiar faces.
So who do we bring on board tonight, Dr. Frey?
So first we go to some of the usuals. Dr. Jeff Murray, one of our sports medicine orthopedic surgeons, right? And Dr. Matt Brandt, one of our foot and ankle specialists. They've been on a million times apiece. And then the new guy.
We got someone new.
Dr. Antonio Loccisano, one of our primary care sports medicine docs. Antonio, tell us a little bit about yourself.
What's going on, guys? New colleague, OG fans of the show. I was telling these guys off air. I've actually been listening to your voices for about a year now. I came across the podcast during my sports medicine fellowship. I did my sports medicine training at Lehigh Valley Health Network in Allentown, Pennsylvania. And I'm a big podcast listener too in general, and I wanted something that was educational, that would keep me in the loop. Looked you guys up, and I came across the podcast, and I thought it was really well made, very conversational, which is what I'm into. And fast forward, there was an opportunity to join you guys. I jumped on it, and here I am now. I told Steve, I don't think he remembers, but during my interview, I said, I've been used to listening to your voice, but I usually put you at 2 times speed. So it's a little unusual to hear you at your normal pace.
Talks a little slower than you used to, huh? Well, welcome, man. I think it's awesome. You had a cool trajectory of listening to us and you were talking about it. You were here listening to us when Jason was still hosting as well.
Yeah.
And then you still listened to when I took over. So I guess we're doing something right.
It's unbelievable. Yeah.
It's crazy.
Freaking great.
I think it's just unbelievable amount of gratitude for everything that we've been able to do with this show.
And I gotta say, it's kind of exciting. Like there are a lot of stories out like that are out there. You know, we had Kevin O'Donnell on, who's part of our group, and awesome guy. And the same thing. All of a sudden, I get a text. He's like, "This is you!" Like I don't know. And then there's been a few of those sort of just situations that arise, and I don't know. It's just kind of cool. It's funny when. Just
an overview of the things we've been able to accomplish with different things. We've had former NFL players, former NBA players. We've had people from
MLB,
MLS. We've had people from the professional combat sports world of Brazilian Jiu-Jitsu.
Right.
All different kinds of things, and some of it's been just we get cold calls from people and just sure.
I listen. I like it. I want to be on.
Yeah. And we've done a bunch of different things. But I mean, what's a show? And we're not going to get into it right yet, but what's a show without a topic of discussion of Joel Embiid?
A little
foreshadowing. It's only shooting for episode 100.
He's
we
on
talk
every
Embiid
show
again. But we do have a show generally focused tonight on the NBA playoffs because that's kind of the hot topic right now.
Heck yeah.
A lot of games going on almost every night. You know, the opening bracket, if you will. Mm-hmm. So many teams going on. So many big names are getting hurt now.
Yeah.
And so we brought all the pros to kind of talk about it.
Right. Some of the news, again, we record on Tuesday nights. So some of this news is sort of late breaking. Mm-hmm. By the time we post it, Thursday night, Friday morning, some of it may already be like old news, but we don't know it yet. Yeah. So let's talk a little bit about some of that action.
Yeah, so last time we were on, we tapped into the injury report of the Milwaukee Bucks, and we talked about Giannis being out with a calf strain. He hasn't played since the 9th. He's still out, and I don't think he's going to be playing tonight under Game 5, I believe. But the big news for them, at least, is that their starting guard, Damian Lillard, who was their big offseason acquisition, went down with what's being reported as an Achilles tendon strain.
Yeah.
He got injured in Game 3. He sat out for all of Game 4. And tonight he's doubtful to play in their Game 5,
right,
where the Bucks are on the brink of elimination to the Pacers right now. And that's why we bring our good friend Dr. Brandt back on, because he knows everything about the foot and ankle.
So my first question for you would be, you have Giannis with the calf strain, you have Dame with the Achilles tendon strain. Or sprain? Yeah.
Strain is what the article.
That would make the most sense, right? Like, how would you differentiate, just common sort of vernacular, how would you differentiate those two different things? How are they different?
Yeah, so both pretty different. First of all, guys, congratulations again.
Thanks,
good,
man.
Good to be back.
Yeah.
Always have a good time.
You only made like 25 episodes. You're a quarter of this show, Dr.
You're
Brandt.
always on. It's great.
Free beer and he's here.
That's right.
But yeah, so with Giannis, it's a gastroc strain, so it's a lot higher up. It's in the muscle belly, it's in the fascia of the muscle belly, which is, I guess you'd say, it's a little bit safer of an injury than an Achilles strain, because the Achilles strain is down in that watershed region or the insertional region where it's a lot easier for a high-grade rupture. And I guess the worst thing you can basically do in an Achilles or in a gastroc strain is you can stretch that fascia and you can rupture that fascia. And it's like you're going to get back from that. It's not going to be as long as what it is if you have a high-grade Achilles rupture.
Right.
So an Achilles rupture, if that pops and that goes, I mean, you're down for a year. And I was on here talking about Aaron Rodgers once and his Achilles and that miraculous recovery, but it wasn't miraculous.
It wasn't the full recovery.
We had a big debate about that.
Right.
So a gastroc, I mean, if you had to choose one or the other, you'd choose the gastroc. But Giannis has been out for longer, and Damian Lillard is, maybe doubtful, but I think that there's no way he's going to be back, tonight. They're not going to play him. There's no reason to risk him, really. I mean, they're already down.
Right.
I think he's done. I think they're done. And it's just like he has a grade one.
Yeah.
I think it's a grade one. They graded it as, based off the MRI, which is, multiple fibers of the Achilles torn.
Right.
That's such a risky thing to go back and push it. And as big as these guys are, he's not Giannis, but he's still a big guy. And he's 32, 33. And it's just like, I don't see at this point on where they are. It's just like, don't push it. Don't put him back out there. I don't think it's worth it.
And I feel like in the NBA, right? Like, one of the worst sports to have this injury, like where it's such like start stop fast, up down
So
fast. Like, yeah.
It's just
It's
always,
like, it's not, It's not like he's a baseball player or
No, he
hockey
can't-
player even actually,
Right.
Because you're in the tight hockey skate.
Oh yeah, the foot and ankle stuff in hockey skates is like not non-existent. But I remember when I was in grad school, I covered hockey and I had some foot and ankle stuff, and I was like, well, you wear a skate that's pretty rigid and supportive.
Right.
I think you're fine.
Molded to you.
It's like
molded. Right.
It's
Yeah.
like, you might have like an arch sprain or something. It's not gonna move in the skate. You should be fine,
You're
functionally fine. You go out there and do your thing.
Right.
And out of curiosity, not that I disagree with you saying sit him out, let him be, but so you rest him the rest of the summer and get into next season. I mean, is an Achilles waiting to happen? I mean, is this the starting pitcher that goes down with a flexor pronator strain?
Right. Yeah.
And you're just like,
Little
all
elbow
right,
inflammation.
when's the UCL, tear coming?
Right.
Whether you shut them down or not, it's
Right.
just they're set up for this moving forward.
Yeah, and I don't think this is the first issue he's had. I think he had a strain before that.
I think he's
with.
been dealing with this Achilles thing for a little bit. For Lillard,
There's
he's
some
kind of
tightness.
yeah. And I think it's tough, especially with the NBA. Obviously, our famous 100th time disclaimer: we don't have actual access to their medical records, but like, these guys will get their rest days and they'll just put Achilles on there or knee or something very vague, and it's like, oh, they're just resting because they have something that's sore, or just load management, which is like a hot keyword in like the NBA nowadays. So I think with those things, ironically, as we're talking, he's limp. There's a clip of Lillard limping across the court right now on the TVs here at the neck of the woods. But
It's good night.
I just think just with the load management era in NBA, it's like much more focused on, it's pay attention, and he's been dealing with so long. And I think however many years ago, the Kevin Durant was like, he put like the poster child of like why you don't push through these calves or Achilles things, because then it snaps.
We wondered the same thing when we talked about Aaron Rodgers, right? Like there was like that earlier in the preseason, little tweak, calf, this, that, and then pop, it goes.
And it's different body types too, and what's demanded of you too. Like we talked about with Aaron Rodgers, it's like it wasn't it wasn't his plant foot. There's a lot less strain on it. Maybe he could have come back from that potentially, but then you look at these NBA players that are, you're running the entire time, and then you look at body type too. Look at Kevin Durant. Like, look at his legs.
Right.
Yeah.
His Achilles is twice the length of ours.
Right.
Yeah.
Right. It's like my arm.
And then going up into his, gastroc, his muscle belly. So there's a lot more tension going through that
Right.
on a 7-foot frame.
Right.
Right.
Than what we're dealing with. And I do think that, I mean, that he is basically like a ticking time bomb for a rupture. He's already dealt with it. He's got a grade 1, so fibers are torn. A grade 1 is some fibers are torn in it. A grade 2 is like it's torn, but the majority of it's intact.
Right.
But it's really risky to put him back out at this point. Why not sit him, put him in a boot, rehab him?
Yeah. So then after that PT and after that therapy, is there anything else they're doing on top of that to try to prevent what Jeff's talking about here? The injury, 1 week into his season next season. Is there anything? Is it just simply that?
I mean, ton of rehab.
Modified rest, PT.
Yeah, ton of rehab. I mean, you can utilize the KT taping
Right.
and kind of try to take some of that stress off of it. But
Right.
I mean, a lot of it too is how they feel and what they how they're feeling out there in warm-ups, and that's why it's like a lot of it's like kind of day to day, week to week. There's no real set timetable on it. But an Achilles strain is always going to be. I mean, I would think it's always going to be a 4 to 6 week injury.
Yeah.
If you tear some fibers in the Achilles,
It's going to
the
take
safe
time.
bet- If this were early in the season and it wasn't playoff time, I think it would be he's out.
Yeah.
For a month.
Simple.
Right.
And I mean, you're like, for the Bucks, for the most part, I think they've had a very interesting year. They fired their coach mid-season. They've hired Doc Rivers. He's done okay. And, then they have this. They're down 3-1 against the Pacers, who are playing pretty good right now. If they can squeak this one out and win, they extend their season, sure. You might have a Damian Lillard potentially back. I mean, even with that, Giannis is like 3 weeks out from a calf strain, which is still up in the air. He's still not going to be 100%. It's like, it's tough, but I mean, or you put your best 5 out there that you got, hope for the best, and if you take it, and move on to next season, hope for the best.
Who has a better chance of playing if somehow they pull it out and advance to the next round? Who's a better chance of playing in the playoffs, Giannis or Dame?
I mean, they are painting the picture like it's Damian Lillard could come back and play earlier, which I'm kind of surprised about.
Me too.
I mean, the gastroc, strain isn't really, it can put the Achilles, but the whole thing is the risk of the Achilles.
Right.
So
Muscle tends to heal better than the tendon.
Right. Rupture of the gastroc is one thing, but rupture of the Achilles is season ender. That's potentially a year. So you strain the Achilles, and that could lead to the Achilles rupture.
Right.
But Damian Lillard already has a partially ruptured Achilles tendon. So I would say the opposite of what the picture they're painting. But, But if they make it tonight, they extend it to another game, maybe put him out there as more of like a decoy, kind of kind of see what you can do, but maybe don't try to push it. But I mean, that's super risky.
And I think with that too is a comparison between Giannis and Lillard on the surface level of their play style, right? Giannis is bigger, he's more physical, he's in theory more closer to the paint region, whereas Damian Lillard can shoot the ball from anywhere. So if you put him out as a decoy, stand him behind the arc, hope for the best, just let him catch and shoot, right? Like,
draw some defenders.
Yeah,
right.
Yeah.
I mean, I don't think there's anything wrong with that. But yeah, Giannis is also. I mean, he's almost 7 foot 250. He's a lot bigger.
He's a much bigger guy.
He's
right?
a lot bigger.
Which kind of brings into our next topic of discussion or athlete is Kristaps Porzingis from the Celtics just went down last night with a calf injury, which is almost identical body type, similar, frame, if you will, to Giannis.
I missed it.
He went down, but he's also been dealing with this kind of like all season is what I briefly looked into it. He said he missed 7 games this year with just reported calf tightness or calf, anything with calf issues. And last night he did have the K-tape, like you mentioned, on his calf. And then he took just a pretty regular step in basketball, if you will. And he just kind of pulled up a little bit, and then he took him out, and he was done. And now I think today he's supposed to get an MRI, and I couldn't find any reports of that before we started recording. So curious of what that's going to be like come Friday when all the reports come out. But, they said initial testing or thought is that it's not an Achilles injury, it's just his calf. So he's probably in the same boat.
Same boat, yeah. I mean, it's like if his Achilles is okay, I think that they would be a lot more in their position. I think they'd be a lot more aggressive, putting him back in and playing and taping him up.
Right.
But it's like these guys. I mean, you're going to base it off of the MRI,
Right.
And really what he can do in warm ups, with the trainer, and but a real similar position. I think that it's going to be day to day with him, and based off of where they're at in the series.
With the more muscle belly type injuries, Matt, is there any increased use of things like PRP and those kind of things in this world? I mean, we talk about kind of have hamstring on the list as something to talk about later, and there's been some stuff that shows that early PRP use in a hamstring may be beneficial. Can you extrapolate that, you think, to the calf? I would think probably. I mean, a muscle is muscle, right? I mean,
I think that these guys they have that ability to have that at their disposal, and I'm sure a lot of them get a lot more PRP than what
unlimited resources, right?
I know. I used to hear about a lot more of the injuries, and they were getting the PRP injections and whatnot. I would assume they're probably. I mean, why not utilize them?
Right.
Because everything's there. They're up to date on everything. Everything's at their. It's all there for them. So probably there wouldn't be a reason not to.
So I think to follow up with that, right? So if you could guess, in this position where the Celtics are up 3-1 on the Heat, right? They have to win one more game against the Heat without Jimmy Butler. And they advance, and they're the top seed, and they've done really well this year. Would you think that he'd be a more candidate to get the PRP, like saying now that he's injured, he'd get it done and rested like a week or so, and then maybe he have a chance to come back? Since he's already been dealing with this, I'm sure they have some kind of management plan, although I also don't think he's left a game because of it. So it's a little different, probably increased severity, a little more worse off than he was. Do you think he has a chance of coming back in the playoffs? Because I think the Celtics come back.
Given their position,
Right.
I think that they're going to be more aggressive with it. He's going to be more aggressive with it. They're going to use everything they have that they can throw at it: PRP, taping, aggressive rehab. But
and he's a big part of their team too. I mean, he's their big guy.
And he's been dealing with it. So it's like I think he will have more of a say in like what I can do, what I feel. Because a lot of that's what you can put in a gastroc in the muscle strain. It's more of like what you can do.
Right.
You're not really going to make it necessarily worse in the muscle and the fascia unless it goes down to the Achilles, and that's the bigger risk.
That team is really good without him, and like really, really good with him. Yeah. So you gotta figure that in all probability they're advancing. And then they wait for other series to kind of wind down. They have a little bit of extra time.
Yeah.
I would imagine he's coming back.
Yeah, I think, like you said, I think even if the Heat pull one out and they extend that series a little bit.
Now, and you alluded to it before. Like we don't have access to his information. Right? We don't know if this is like a really bad calf injury, like assuming Giannis is one of the more severe ones, right? Like because it's been a while, and like
it's been 3 weeks about 3 weeks, I think, today.
And sometimes that's how it goes, right? So I mean, I guess we never know, but if they can get him back, I gotta imagine they're getting him back.
Yeah.
If they can pull off this win, I wouldn't be surprised to see him out there.
Yeah, close it out, and then
I think it's much easier for the Celtics to win one game against the Heat without Porzingis than it is for the Bucks to pull out the series down 3-1 without Giannis and without Dame Lillard.
Yeah, they're in trouble.
And Chris Middleton is like probably their best guy on paper, and Drew Holiday are probably their top two guys right now. And Chris Middleton just came back from a quick little ankle sprain, although he came back and dropped 42 points with it. So must have been a kudos to their AT. Got a really good tape job on that one. But, it's crazy how fast. It's just basketball players are just funny. Ankles, they're all loosey-goosey anyway.
We're kind of ripping right through all our foot and ankle stuff because we have Matt here, and we know Matt has to exit relatively early. I think the most interesting one, sometimes I love having these shows and we know exactly what the injury is. We go through a lot of details. Sometimes the speculation type discussions are the most fun, right?
Yeah,
so
and I would say speculations that don't make my list that I print out, before the show. I mean, this when I was setting up, having my pre-show beverage and kind of getting everything together, and I was just looking over. As a Sixers fan, I checked the injury report for our game, and the Knicks are down without their one of their guards, Bogdanovich, who left Game 4 was reported as a foot contusion, and he was dealing with, so a little backstory, he was dealing with a wrist injury. He reportedly had some ligament damage in his wrist, but they were saying he's going to play through it. He checked into Game 4, and within a minute he got tangled up with Batum and fell down and awkwardly on his foot, limped off the court. Reported was a foot contusion, and then about 2 hours ago it just said he's getting season-ending surgery on his wrist and his foot. And that's where the speculation comes in on, like, what the heck happened to him?
What's your guess? What do you think is happening here?
So, they say it was a contusion because they most likely took him back right away, took x-rays. X-rays were negative.
Right.
And the only thing I could think of where it's a negative X-ray, so they reported it as a foot contusion, maybe some bruising.
By negative, you mean no obvious fracture noted
Right.
on the X-ray.
No fracture, no dislocation, but it's like these guys have access to an MRI so early. They probably got that MRI afterwards, and it showed a Lisfranc rupture. We've talked about Lisfranc on here a few times.
Can you rehash a little bit what that means? Because you're right, we have done full shows on it.
Yeah, and you can talk a lot about it. So the Lisfranc ligament is a ligament from the medial cuneiform to the base of the second metatarsal, which is like we call it kind of like the keystone to the arch of the foot. So it's a really supportive ligament, and if you rupture the Lisfranc ligament, it destabilizes the foot, destabilizes the arch, and you essentially, in these guys, I mean, you have to fix it.
Right.
So it's likely that he took this is one of the most missed injuries in the ER.
Right.
Or in
all the
urgent
time.
care, where it's just like your X-ray is negative. There's nothing out of alignment. But if that clinical exam, it's bruising on the top of the foot, like a golf ball on the top of the foot, bruising on the bottom, pinpoint bruising right in the arch of the foot is really indicative of a
pathognomonic,
Lisfranc injury.
right? Like as you see that.
Yeah, you see that, and it's an automatic. You get an MRI.
The red flag
you
has to
look
go
at
up.
the Lisfranc.
Yeah.
So it most likely was a Lisfranc injury, probably ruptured his ligament, and probably purely ligamentous. So that means that you're going to have to go in there and fix it. And a Lisfranc injury, it's like an Achilles injury. It's like you'd rather just break a bone, be back in a few weeks, as opposed to like the Lisfranc or an Achilles. Talking about the Achilles again. Those ones that's a potentially that's a year-long injury. You can come back from it, but it's a long recovery. So it makes perfect sense that it was a Lisfranc injury. It was negative X-rays, no fracture.
Yeah.
So, what are your thoughts on him coming back? His level. I mean, I think the interesting thing is that he's 35 years old. He's
Not a kid.
He's not a young guy in the NBA anymore. He's on the latter half of his career for the most part, and he's got this injury. And I think he was averaging like 10 points a game or something. Very good bench player.
Good player, yeah.
Very good player. He's always been. I think that whole family has good NBA players. There's a couple of them in the league right now. But what do you think it does for his career outlook? Do you think he comes back? Do you think he's
That's super variable. It depends on the extent of the injury.
Yeah.
There's so much. Like I said, we've talked whole shows about this, and you could talk forever about the different types of Lisfranc injuries and how to fixate them, how to repair them. If it's purely ligamentous and there's no shift of the metatarsals, the midfoot is not shifted. You could potentially go in and put, we call it an internal brace between there and stabilize that and basically recreate the ligament.
Good friends at Arthrex.
Yeah. And that you can recover from. But if there is a shift in the metatarsals where they shift, laterally or medially and laterally, I mean, sometimes you have to put a lot more hardware in there. And if it's something like that, where there's any type of comminution in there, which you didn't see, and sometimes you look at an X-ray, and the X-ray is read as negative, and the radiologist reads it as negative, the ER reads it as negative, and you get it, and it looks fine, but the clinical picture is really swollen, that bruise on the bottom.
Yeah.
And you get the CT or an MRI, and there could be 6-7 fractures through there that are non-displaced, intra-articular, like in the cartilage. You damage the cartilage, and if it's something like that where it's requiring more of a fusion as opposed to just a simple repair of that ligament, then he's probably done.
It makes me think that it has to be not that it has to be, but it's so likely that this is the injury for all the exact reasons that you're saying. The people who do have this particular injury tend to do better when you get to it earlier, right? So then they're not even messing around. Like, he's done. We're just gonna fix it. Just do it.
Yeah, and then see how he does. And there's without seeing imaging and without knowing what procedure he went through, it's almost impossible to tell. But
Right, but I mean, your best guess, and I think that's kind of what we talked about pre-show a little bit. Is like, I don't know, looks and seems like a Lisfranc injury.
Sounds like a Lisfranc.
Every time, it's similar like Jeff was just alluding to, right? Like when you have a pitcher and they're like flexor strain or like inflammation. Like I'm like, oh, here it comes. Like it's the Tommy John surgery is just down the road, like kind of a thing. Like you kind of feel like it's coming, and it's not 100%, but it just happens more frequently than you would like.
Right.
Every time they say bone contusion,
Like
literally like foot contusion, I'm like,
foot inflammation.
very
vague,
I'm
and
worried where this is headed.
They drag it along a little bit, then they get dropped. Oh, they're having surgery now. So, that's a quick transition.
I know. It's always worrisome. It is, for real.
So I think that's most of what we have for Dr. Brandt.
Some of the foot and ankle stuff. You're welcome to chill out for as long
absolutely.
as you can.
Yeah, I'm hanging over here, but thanks for having me again.
Yeah.
Appreciate it. Good to see you guys.
Yeah, man.
Congrats
Always.
again.
Thank you.
Thank you.
Appreciate all your help.
Thanks, buddy.
See you Friday morning.
All right.
All right. So our good friend Dr. Brandt's got to get going. So we're just going to keep on cranking down.
Yeah.
So we went from a familiar face. Now we'll go to the new face of the,
The
show
new
tonight.
face.
You right?
Yeah. And like totally different topic. Really
yeah.
kind of like fringe sports
Total
medicine. Just happened to happen to an athlete. So let's talk a little
Yeah.
bit about it.
So it's not a sports medicine on tap episode if we don't mention Joel Embiid from the Sixers. It's part of our process, if you will. So it kind of was. I don't know what sparked the reveal of Joel Embiid's injury. I think he kind of brought it up too in a post-game interview. He said and it kind of happened simultaneously as like a couple of buddies of mine were sending videos of him from the game and his eye, and they're like, "What?"
A lot of people were all saying
A
the
lot
same
of people
thing.
were like, "What's going on with
wrong
Joel
with that
Embiid's
kid?"
eye?" Like
Right.
everyone's like talking about his eye. I was like, "I don't know. He just dropped like 50 points the other night. I think nothing's wrong with his eye."
Eye seems to be working.
My wife actually, while she was watching the game with me, she pointed that out
Yeah.
immediately. She was like, "He looks unwell. What is going on with his face right now?"
Right.
And I think it's just, everyone's focus was on Joel Embiid's knee,
Sure.
Like, it was his left knee, this is the surgery, how he's looking, and he had some weird falls where he kind of came up a little lame, and it's like, oh, man, that knee's not ready, whatever. But I think this injury stems back from the playing game against the Heat. He went up for a rebound and got hit on the left side of his face.
Oh, is that right? Was that what
Yeah.
they're saying was the start of it?
So it happened then. It kind of was under the radar for a couple games. He's
Right.
had that big game, and even in that, I think the Game 2 loss in his post-game report, he was just face down the whole time. He honestly, I don't even think he looked
He was
up at a
hiding.
reporter. He was hiding, and he kind of came out and said, "It's like, yeah, I've been hiding my face." He's like, "I'm trying not to make a big deal out of it because it's a story as old as time. The Sixers in the playoff, and Joel Embiid's hurt. Like it always happens with these two things in sync. It's like they just did the tip off for the next game tonight. So I don't know, so we bring you on.
Yeah. So fortunately for you Sixers fans, I grew up in New York myself, so I'm rooting for the opposing team here. Sorry to say, but
It's all good.
This is not an orthopedic injury per se,
Right.
and it's not anything that's going to prevent him from playing.
Right.
It can be a bit of a nuisance. So,
Right.
Bell's palsy, essentially, so what is a palsy? A palsy is kind of an umbrella term in medicine. Essentially, it is either a partial weakness or a complete paralysis of a muscle group. So Bell's nerve palsy is a nerve injury specifically to cranial nerve 7. So we have 12 cranial nerves. Cranial nerve 7 is the facial nerve. It has motor innervations to various muscle groups in our face. It also has other special nerve fibers that control taste, specifically to the anterior 2/3 of the tongue. It has special nerve fibers that go to lacrimation glands and salivary glands, which is probably why there was a report that came out that he's been using eye drops for his eyes, because it does lead to problems with spontaneous blinking and with production of tears.
Right.
So in terms of his play, the only thing I can really imagine it impeding is, he's probably experiencing dry eyes when he's playing, and obviously that's going to hinder his ability to make shots or to play comfortably on the court.
Right.
But it's not anything from an orthopedic standpoint that should prevent him from playing.
Right.
I didn't even consider that part of the equation. That's interesting.
Yeah. Yeah, I think it was like, and I think I read similar reports of like, or at least doubling on it's like the video of him at the free throw line. He like looked down and looked up, and his left eye just didn't shut. He's like blinking with his right eye, and his left eye's like looking all over the place. And you're like, whoa.
So
It's tough.
It's interesting that we're assuming it happened from this collision play, or
Right.
this hit. That's a little bit more of an unusual mechanism. of
I was
injury.
going to say, I didn't realize that was a
It's
possibility.
usually idiopathic, so spontaneous in nature or unknown origin. There are higher
Viral.
risk factors with
Well, yeah, I was
viral-
going to say it was kind of like a split article of like he's been sick, he might have this
Yeah.
virus, but then he also got hit right in that same eye a couple days ago when and then it's been just
The most commonly associated risk factors in terms of viral origin, you're thinking influenza A, you're thinking varicella, you're thinking herpes zoster. Those are the big three in terms
Right.
of viral etiologies. And then there's other things that come into play. Other risk factors are traumatic, immunosuppression, diabetes, things that I don't think really pertain to him aside from this
Right.
traumatic incident.
Right.
So that might be the cause of it, or it just might be incidental from a more recent viral infection, which is what his migraine headache might be related to. We don't
Right.
know.
Oh,
Yeah.
that's interesting.
And then,
Right.
as of today, it's Tuesday, and the show will be released Friday. But Tuesday morning, before the Sixers game tonight, he wasn't at shoot-around because he was reporting he had a migraine. So he was kind of out, and his status was questionable. But right now, he just blocked a shot, and he's playing in the game against the Knicks tonight. So we'll see what the heck
Good
happens.
job.
But it explains why he presented the way he did in terms
Right.
of his face, because obviously if you have injury to this nerve, the first thing that's affected are those muscular innervations. So
Right.
it's going to be inability to raise your eyebrows, or
Right.
inability to spontaneously close your eyes or blink.
Yeah.
Some people will have issues with their smile, so they'll have an uneven smile.
A little bit of droop.
It's
Yeah.
kind of scary when you first see it, because a lot of people can commonly mistake it for a stroke.
That's
Right.
the first. That's the first look
and,
that I remember.
And the deciding factor there is the forehead. So if there's forehead involvement, and not to get too much into the weeds.
No, this
in
is
terms-
great.
In
No, this
terms
is-
of the neuroanatomy,
Yeah.
but Bell's palsy will always have forehead involvement because of where the upper motor neurons desiccate in terms of the cerebral cortex. So the nerve fibers specifically that go to the frontalis muscle, which is the muscle that allows you to spontaneously lift your eyebrows and make wrinkles in your forehead. Those have upper motor neuron fibers originating from both contralateral, ipsilateral cerebral cortex side, whereas the other lower motor neurons down below, they only have innervation from the contralateral side. So Bell's palsy will always have forehead involvement, whereas a stroke will not have forehead involvement. The forehead will be spared.
Yeah.
So that's a deciding factor.
That sounded pretty amazing. I'm going to keep it with that one little last tidbit. All the other logic there. Yeah. Remember, it's an orthopedic show.
Yeah.
But no, that's you just taught me something, so that's
Right.
pretty interesting.
That is crazy.
Yeah.
So, one of the thoughts I had, and I didn't even think about like the whole idea of like tearing and blinking and that part of the equation, which is, it is actually very, very interesting and applicable, right, for this scenario. What about his eye? Does it affect his eye at all? So like, he just lit it up, right, in the game. 4 threes in the third quarter
yeah.
and whatnot. Like does this impact his ability for his eye to focus, for his eye
Depth
movement, or anything like
perception.
that?
It should not affect, in theory, it should not affect any sort of pupillary dilation or constriction, right?
Yeah.
So it's not affecting his vision per se, but it will definitely affect his ability to spontaneously produce tears.
Right.
So dryness is going to be
Right.
the main concern.
Right. Right.
And he's running up and down the court with just an open eye, and it's not going anywhere. It's getting all the air particles just going through there,
Right.
and it's just super dry, I would assume. And it's kind of interesting too, is that I think after this report came on, I think it came on after Game 3, and then they played Game 4. Anytime he was at the foul line, it was just like his nose up. It was just all in his face. They were just trying to show the camera to his face of what was going on. It's like, all right, we get it. The guy can't really blink that well. We understand what's going on here.
The good news for him is that probably up to 80% of cases spontaneously resolve within 3 weeks.
3 weeks.
There are studies that show it can extend further out to 8 weeks, worst case scenario, 3 months. You don't have to necessarily do anything in terms of medical treatment. It can spontaneously resolve. A lot of people will use oral steroids to kind of expedite the rate of recovery and increase the chance of complete recovery. And that usually is about 7 to 10 days of oral steroids. It's a fairly high dose. It's 60 milligrams. I think the most current literature, it's 5 days of a 60 milligram dose, and then an additional 5 days of a more tapered course.
I got you.
But that's essentially all you need to do for this. Some people will play around. Some neurologists, I've seen them combine it with antivirals because of that increased incidence with viral infections. That has been shown in weaker studies to kind of lower the rates of incomplete recovery, but it doesn't expedite your complete recovery. So whether you use antivirals or not, it's not a big make or break. Some people will just completely just only use steroids, which is the current recommendation. I don't know if he's on anything right now, but that's the current guidelines for this.
Hopefully the steroids will make his knee feel better.
That's exactly what I was about to say.
Right. Now,
Exactly.
I guess, right, with that being said, his previous history of knee surgery wouldn't be a contraindication for any of those
No,
treatments,
not
right?
at all.
It would all be,
Yeah.
if anything, like you said, it could
It's
potentially
definitely going to
help.
make his knee feel better, yeah.
We'll take it. Give him some steroids. Let's see what happens. We just got to get through this game, and we'll hopefully be able to talk about more Joel Embiid next week.
Yeah, that's it. As long as he's playing, I'm sure there's going to be a topic.
It's going to be something, right? So
Wait, before we go down there, you talked about this being cranial nerve, right?
Yes.
And any mnemonics that you remember about the cranial? No.
Going to bring me back to my med school.
That's right.
days,
That's
please.
Yeah.
right. Yeah. All right.
Oh,
I don't know
that's
if it's I guess a kid-friendly show. We can't
That's
go
right.
down that road.
Yeah. So we kind of mentioned briefly Dr. Bernardini was going to come on, and we had some stuff for him too. So we'll kind of blend that stuff together with Dr. Murray's here. So we'll give him a little bit of everything.
The both. Yeah.
Get
The idea
get a
was
little
for them
extra
both of them
homework
to
tonight
talk
now.
about it. Yeah.
So we kind of mentioned before, Jimmy Butler went down in the game against the Sixers with the MCL sprain.
Yeah.
Pretty wicked fall, in my opinion. And I texted Dr. Frey when it happened. And that
did.
was like a week and a half ago. It was a long time ago. And I was like, oh, I don't know, man. The way he went down, he just went down. I was like, it might have been his ACL. He fell awkwardly.
Right.
But then he got up and he kept playing. I'm like, this guy just doesn't
false
stop.
alarm.
False alarm. And I was like, all right, well, he's back out there running around. But then he finished that game, and then they
That was it.
quickly shut down, out for a few weeks.
Yeah.
And so what are your thoughts on that, Dr. Murray, and what do you kind of take from the severity of the injury based off the information we have?
Yeah, I mean, it kind of goes back to similar conversations that Matt was talking about with, levels of injury to the Achilles or, gastroc is, you look at the MCL and you look at levels of injury, grade 1, 2, 3. Obviously, he's not headed for surgery, so you don't think he's got any sort of avulsion injury or anything, that would require that. But if he had a grade 1 injury, he'd be back. He'd be good by now, right? Maybe playing with a brace just to be safe, but he'd be back.
On the court.
When they say at least a few weeks, I'm guessing he's probably got at least a grade 3. Because grade 2, they'd probably still be saying, maybe a week or two he'll be back. But
Right.
grade 3 can be 4 weeks, 8 weeks. And again, I think it depends on where they're going to end up. But I mean, that team in general is on fumes. Everybody's out. I mean, they just said Jaquez didn't travel with the team because of a hip injury. So, I mean, it was amazing they beat the Bulls to even be where they are after he went down in the previous game.
No,
so
I agree.
I have to imagine, unfortunately, that playoff Jimmy is done for the season because he is exciting to watch.
I know.
Once the playoffs start, he goes into a whole nother dimension.
Yeah.
It's unbelievable.
It's unbelievable.
I mean,
He denies it,
Tobias Harris over him. I mean, come on.
Yeah. What more can be said? And it's kind of interesting in that after talking about Jimmy Butler, I kind of came across him on Instagram or whatever, and I kind of went through some of his stuff. And that guy loves playing cards.
Oh, really?
And I mean, he's doing his rehab on one side, like looking to his right, doing his rehab, and on the left, he's playing cards with one of his buddies in the training room. And I'm like, this guy he's just playing.
He's just a baller.
Oh, he just-
I would love to have
Competitor.
him on our team.
just competitor.
I'd be curious what kind of money's on the line.
Oh yeah, right. So he's like in a whirlpool playing games, and I guess in their facility wherever they have a small little small basketball hoop, and he's like, I think he's betting the PT or ATC, whoever they're just how many shots he's making. He's still just doing his thing,
Yeah.
And I mean, he's still just like we said, it's playoff Jimmy. It's an unbelievable thing. That it's unfortunate that the fans of the basketball world don't get to see that this year because he got hurt pretty early in the playoffs in the play-in game, and like you said, they squeaked by the Bulls, and they're down 3-1. Even against the Celtics, with or without Porzingis, I still think they're going to probably be on their way out.
I think I would imagine so. If Jimmy Butler is playing, maybe it's a different story, especially after Porzingis if he misses a few games.
Yeah.
I'm kind of curious, Jeff. So your estimation was that it's probably a grade 3, right? Like grade 1, I usually say like a week. Grade 2, like 2 weeks. Kind of grade 3, and then it could be a while. But yet he's not going down the road of a surgery. Is there a difference that would sometimes dictate whether someone would get into a surgery, have surgery for that a little bit sooner? Assuming it's grade 3, and that's a big presumption.
I mean, I briefly touched on it a little bit in saying that he doesn't have any sort of avulsion type injury. So and what that means is basically instead of just damaging the ligament itself, a piece of bone pulled off with the ligament.
Yeah.
And when that happens, it can kind of get interposed, or more tissue can get interposed between those, and then it won't heal properly.
Right.
So you got to kind of go in and heal that back down, or fix that back down to get it to heal properly. And then, we've generally been more aggressive with fixing some of these in the face of an ACL injury at the same time.
For sure.
Clearly, he's had an MRI. Clearly, he doesn't have that, although there's a high association with it. There can be meniscus injury associated with it as well. He obviously doesn't have that. So, sometimes if we'll be more aggressive with those grade 3s if we're already going to be there doing something else.
Yeah, for sure.
But in the absence of that, it's generally those, acute injuries with some bony avulsion
I think the tibial side of ones I tend to be a little more aggressive about too. Like the threat of the kind of like a Stenner lesion for the knee, and is it so you have tissue interposed between the where the MCL was attached and is now on the other side of it, and it can't really heal back down. You got some tissue in there. I don't know. Become a little more aggressive about that.
Yep.
We just got someone back on the show. I'm kind of curious to get his thoughts on this whole action.
And he only brought himself a beer.
That sounds about right.
I thought you guys should have been filled up.
Well, welcome to episode 100, Dr. Bernadine.
Wow, it's super exciting. I know you probably maybe went through some of this already, but I want to just congratulate you guys. This is really awesome.
Thanks, man.
Yeah, really awesome. Sticking to it and doing a great job, keeping it going.
Now, shout out to Frank for having us here week in, week out, hosting up. Yeah. We want to have him on the show. Wasn't able to do it tonight. And also, shout out to Jason, one of our creators here.
Yeah. I talked to Jason earlier in the week, and he had no voice. So, yeah.
Hence his absence. He was invited to episode 100.
He was,
There's
no way he could not be.
He could not speak.
Shout out to ASI, Advanced Surgical Institute, surgery center we go to. Send in a few people over to hang out and enjoy.
Little fan group for the episode 100.
Fan group for the crew.
Yeah. But all right, so I was talking about Jimmy Butler and some MCL type injuries. Now you just sat down, you missed half the conversation.
I did. I'm sorry. I apologize. We were doing some critical equipment moving.
Yeah.
Totally understand some logistical issues early on.
We had some issues. I appreciate you guys.
But you're here. Hey, it's all good.
I'm sad to see Dr. Brandt left before I got back.
And sometimes things don't go the normal way. So I'm going to kind of one of the injuries I put on the list under your name tonight. The Timberwolves head coach made the injury report, which is a rare thing to see. The coach's his job's to go out there, coach his game, but he got ran into by one of his own players. It was a little friendly fire.
Yeah.
And then he tore his right patellar tendon.
Yeah.
He got bumped from his left side. He went to go kind of make a plant or just to stabilize himself with his right leg. Whole thing popped.
How old is he?
I'm not sure. He's on the...
Good question, right?
Yeah. But it's interesting because the Timberwolves swept I forget who they played. They swept their series, if you will, and they're on to the next round. So what's that do for a coach coming back from patellar tendon surgery, because he's going to have to get it fixed, right?
Yeah, very interesting. He's going to be limited for sure, especially if he's an active coach.
Yeah, right, if he's getting him down the court.
That's one of those injuries that we consider kind of urgent elective kind of procedures. Definitely something that has to be fixed in order for you to be functional. You can't straighten your leg, can't walk, can't squat, can't walk up and down the sideline, can't yell at your players. Without being physically imposing.
Right.
You can do it from a chair, but it's not.
It's not the same.
It doesn't carry the same sort of.
It's not intimidating.
And you're worried about people tripping over his legs sticking straight out from the chair?
Yeah,
that could bend his knee.
Crutches, extra implements on the sideline.
So which is interesting, right? So
sometimes refs.
Patella tendons have gone through some evolutions of surgical techniques. Originally, we did bone tunnels through the patella, and those I was really restrictive with. They weren't as strong. The newer techniques are anchors.
Yeah.
Those, I don't know about you guys, but I tend to mobilize them a little faster, so he might not have the same limitations as far as being able to bend his leg early. But, early on, you got to take a lot of stress off of that. So he's going to be probably immobilized in extension for a bit. And
I got to credit Dr. Jeff Murray for turning me on to that.
The anchors?
The injury?
Yeah.
Oh, the anchors.
The anchors, yeah. Switching me from bone tunnels to the anchors.
Yeah, it's been a nice switch. I think we've all probably made that switch at this point.
Yeah, I mean, sadly, the literature says that the anchors are better than any knot that any of us could tie.
Yeah, for sure.
I got you. No, and I think that was one of those interesting, odd injuries, and I think that's something that we all probably have a story of when you're covering something on the sidelines and something or someone who's not an athlete gets injured, and you're like, oh, crap, and then they call for the doctor, they call for the athletic trainer, and you're like, oh, crap, we're the ones here. I guess we're going to have to go.
You're going to have to handle it.
I've been in the stands before in a game, different things where it's just when life throws you a curveball at an athletic event, you just kind of have to act, right? It's kind of definitely not what you plan on doing that day when you go into the office, if you will.
And just to clarify, the reason I asked the age,
I was going to go right down this
yeah,
road.
yeah, generally youngish people tear their patella tendon, and oldish people tear their quad tendon. So, what do they say? The patella is 40.
40, yeah.
And,
So if you're younger than 40, it's
If you're
patella.
younger than 40, it's usually patella tendon rupture. If you're older than 40, it's usually quad tendon rupture. But they effectively have the same treatment algorithms, and
It's a
54.
He's what?
54 years
So
old.
he's
spry young
right,
54.
Exactly.
He's an outlier.
physiologic age, not chronologic age, right?
That's right. That's right.
He's an active individual. We'll say.
Active individual.
He's got a young team. They're doing
Yeah.
pretty well.
Or it was misreported. It's actually his quad.
It very well
Could
could
be. Yeah.
So a couple other ones that we had for Dr. Bernardini while he's here. We did have the Pelicans, Zion Williamson with his hamstring that was kind of out. And I think he kind of goes along with the same breath as Joel Embiid. Great, phenomenal athletes.
Yeah.
But, man, they just got hit with the injury stick so hard and they just can't find their way out of it.
Yeah.
It's just all the time.
Yeah.
And like we kind of mentioned last time.
As a small guy, put together pretty well, not any major injuries during collegiate sports. I'm going to throw it out there. Big guys aren't put together well.
Yeah.
Yeah,
Very
long-
often, they get paid big bucks for their sport, but
Right.
Longer levers, bigger muscles,
Yeah.
more tension, more force.
And when you see Zion,
little
like,
old guys is not a coincidence.
Right?
When you see him, it's like if he's just walking down the street, you look at the size of that guy,
Yeah,
right?
holy
Like,
smokes.
but
Huge.
you're not thinking like extraordinary athlete. You see him move on the court, and it's almost mind blowing, right?
Yeah.
Like what he can do. But is it the fact that it's that combination of like being a big guy, the size, and being that like fast and like that explosion, that
explosive.
agility that just
Yeah.
it can't keep up. Like,
That's
it's
one of
injury
those
after
injuries
injury.
too that happens, right? I
Right.
mean, it's super common. So I like to take shots at tall, big guys when I can.
Every chance you get.
Every second of the day.
You got to.
Right.
But the
right.
reality is, that happens in a lot of explosive
Yeah.
players, and we see a lot in specialty players. I'm a football guy, so we see it a lot in defensive backfield and wide receivers and guys who move fast and explode. I don't know do we have any reports yet about what level, proximal, distal?
I couldn't really
mid?
find too much, and I to be honest, I didn't go too crazy into it because the Pelicans got knocked out when I was getting everything
Yeah.
kind of squared away. I was like,
Yeah,
he's got all the time in the world now to get ready
Right.
for
Yeah.
next season.
yeah, and he will.
Yeah.
And if he was in season, it's maybe a little bit more interesting conversation about how you treat that and how aggressive you can be, and muscle belly injuries, you can do PRP injections, maybe buy him a week, things like
Look at that.
We were talking about
We
that a
just
little
talked
bit
about
in
that too.
terms of the
That's
gas
awesome.
drop, right?
Yeah,
Right.
yeah.
Exactly. Do we know, is this the first time he's had this particular injury, or is this recurrent?
I'm not sure, but I would
That-
guess it's probably not.
Yeah,
I,
me
I'm
too.
going to assume that it's probably not.
Oftentimes, like once
Yeah.
it happens, it comes that recurrent
And it's almost,
nagging.
it's kind of
Yeah.
interesting, right?
I got one of those.
Yeah.
Yeah.
Like we're kind of in the era of the bigger, faster, stronger. Like is our world of strength conditioning and like training outdoing our human anatomy at this point? Like, are we
Big
I
question right
wonder
now.
that.
like
It
training so hard that like our bodies aren't kind of meant to go that
For
fast?
pitchers, I think it all the time.
Well, yeah, I think to talk pitcher specifically, like I don't think a youth elbow is supposed to throw that fast.
Very unnatural movement pitching.
So that's a whole nother can of worms we can open up. But I think with these guys moving so fast, doing all these things, and they get these hamstrings, these calves.
Yeah, I think we talk a lot about injury prevention and not just treatment, and hamstring, calf, quad. We talk about eccentric strengthening exercises, trying to work on prevention. You would hope and think that these guys are doing this, right? They're at
Right.
the highest level.
Mm-hmm.
They have the highest,
They have access to everything.
access to everything. They have highest, trained professionals working with them. Surprisingly, some of these camps are old school, and they don't necessarily prescribe to the new school science stuff, and we try to be evidence based, blah blah blah. But eccentric strengthening of hamstrings is super critical. Like and for people that are listening, eccentric is basically when the muscle's under contraction but lengthening instead of shortening. So there's two phases to muscle
Those
contraction.
negatives, if you will, at the gym,
Exactly.
right? Yeah.
And those are really, really critical for injury prevention, and they're actually been shown to be better for strength development.
Yeah, and I think actually we posted on the video the last time we were on. It's like it's just not an appealing thing for people to do.
It's not fun.
It's not fun.
It's not sexy.
It's not attractive. You can't make a cool Instagram or TikTok
It
video.
doesn't look
of
good at the beach.
It does not. You know what I mean? It's just not part of it. But I think it's even like I was kind of having a similar discussion about this in regards to yoga today at work. But I think the athletes nowadays are just so fast, so powerful. It's like, but it's so hard to like take a step back and slow everything down. No one wants to really do it, but it's really difficult to slow things down and try to like really control your movement and like biomechanically be sound.
Yeah.
And it's like, nah, I'd rather just go dunk the ball and work on my free throw. You know what I mean?
And if you can, why not?
Yeah. I've never dunked a basketball. I'm sure it's pretty freaking cool.
And the reality is, youth will hide a lot of those injury risks. And you know, he's not, but he's young.
Yeah.
He's not old, but you know, again, big frame, big, you know, force production.
His weight has been his primary issue in his career so far. I mean, there were reports that he lost maybe 40-ish pounds this year, which is why he was able to play at the level he was playing at this season. But I mean, up until this point, he's been plagued by injuries, and a lot of it is just his massive frame and the impact and the load that's putting on his lower extremity. So I would hope that with this time off, he's able to maintain that and even lose a little bit more weight, because that's just going to help him going forward to kind of optimize his performance.
No, I agree with you. That makes a lot of sense.
And we talked a little bit about the level of the injury, and you know, a very proximal up near your butt is kind of the hard spot. You know, and that's if you have a major injury there. It's you know, kind of in our group, Steve's our whether he likes it or not, Steve's our go-to guy for fixing those. And those
Has he passed that to Kevin yet?
I think, hopefully he's not here. Then
he's not here. He's on board.
He's our proximal hamstring.
He's our hamstring guy.
So our new sports doc, Kevin O'Donnell, who's been on, is great, and he's got some hip experience and pelvic. You know, I never, throughout my whole training, never had any experience with any of them. So so it's not something you want me to do.
There you go.
I like how you floated that disclaimer
like that?
to make sure.
So don't
to make sure.
Steve.
Yeah.
Go to Dr. Frey for that one. While we have everyone here, we did get a little bit of news from the ESPN alert right before we started recording of another big name, not basketball related, but local
hometown hero.
Hometown hero, if you will, Mike Trout, getting surgery on his torn left meniscus. Just came out tonight.
Do you know which meniscus? Medial or lateral?
I don't think.
Because remember, we've had conversations about that. Very, very different.
Back to Joel Embiid again.
It all comes back to Joel Embiid.
Right.
Yeah.
Joel Embiid had the lateral meniscus, I think it was reported. And
tricky. That's a tricky.
Still kind of struggling.
Still kind of on off. Hopefully his facial steroids are helping his knee, so that's kind of what we alluded to
I'm fairly
earlier.
certain we predicted that he would struggle after the second meniscus.
Oh, yeah.
Right?
I think so, yeah.
You know what would be great? If you maybe somebody like Brandon went back in time and looked at all our predictions and did a statistical.
It's 100%.
100%, right?
We're going to have to look.
We're
going to have to look. We're always right.
Perfect.
You know? But no, I think it's kind of interesting. I don't know much information about the Mike Trout thing. Like we said, we all kind of got an alert from our ESPN when we were kind of hanging out, talking for pre-show. Could be interesting.
Mike, early 30s now? 32-ish?
Should be 31, 32. About the same age as me.
Yeah.
But I'm not a professional baseball
Thanks, bud.
player.
You're close.
Do you think
It's just you chose a different path.
Yeah.
he needed more time to work on the golf course?
It could be. It could be, you know, he may take some time, be local a little bit.
Yeah.
To make sure everything's going well on his golf course down here in South Jersey. Could be right.
High level.
Yeah. But another interesting kind of meniscus-like injury was Kawhi Leonard. Dr. Frey and I talked about him a little bit last time. He was out for a little while with some knee inflammation. Then he has a long history of different injuries for his, I believe it's his right knee. He was kind of clocked at 25 minutes per game in 2 and 3, and then the report was that it didn't respond well to his management plan, and he ended up sitting Game 4, which was on Sunday 2 days ago, and I think they play tomorrow night. And I think his status is up in the air, and he's had a partial ACL reconstruction.
What?
No,
that's a whole episode
I know,
right there.
I know. So he had a partial ACL tear back in 2021, I think.
What does that mean?
Right. And I think it went poorly, conservatively, and then he did have surgery on it. And then he was dealing with this just management of his knee and inflammation, other things like that.
Yeah.
And now he's kind of in and out of the playoffs. I don't think the stat line's doing too good for the Clippers, not doing too great. And now he's out, and I think he's doubtful for this Game 5 coming up.
Yep, at best.
I've gone on record saying that partial ACL is BS.
Yeah.
You think so?
Yeah, so this way I look at it. your ACL has two functional bundles.
Yeah.
And you're going to either tear the whole thing, which is both bundles, or you're going to tear one of the two bundles, which has a very specific function.
Right.
And to partially tear like one bundle or just part of it, you're still losing a whole part of the function of that bundle. And so that can still be very disabling depending on what it is. And so the bundle that controls pivoting and rotation is probably the one that's worse.
Right.
If you're going to tear one for an athlete. Yeah.
That last sentence was exactly what, or the last
You didn't agree
two
with
words.
me until then?
Not that I disagreed. Not that I disagreed, but who it happens to and the mechanism and things is the key to that, right? Like the weekend warrior might be able to get away with the partial ACL tear. Kawhi Leonard, not so much.
So technically, it is I guess a partial. Okay, I take it. Technically, it's a partial ACL tear, but it's a complete tear of one of those functional bundles.
Yeah.
So you're losing that part of it. So it's not like the same as a partial MCL tear where effectively you still have
the most of its integrity and function is the same.
Right.
I gotcha.
Yeah, and it can heal.
So, but so the one argument I throw up there is that sometimes we'll see these tears, and they're by the distal insertion near the tibia, and it's a little bit of edema within the ligament, but it's still in continuity, right? Maybe there's a tiny bit of stretch, and I feel like those ones, like if it stretched a little bit too much, you're never really going to get your functional stability back when you're playing. If it didn't stretch, if you were lucky enough that it only stretched a little and it's not that much, and it wasn't a bundle coming off, then like sometimes you're okay.
Yeah, we're kind of grouping things. There's always exceptions, for sure. But I mean, in my experience, every time I see a report on MRI that says partial, I'm like,
Yeah. No, and you see partial almost every time. It's like unusual to get full ACL tear. You see partial, I think the majority of the time, but we know
that's
like
where
lots of times, you do it, and you're like, no,
you do your exam and then you make a decision based on that.
There's an MCL sprain on almost every MRI.
Almost every MRI.
MRI, it's crazy. Grade one.
Yeah.
And I think it's interesting too with this Kawhi case because we kind of parsed it together and we talked about it before. Is that he's had a history of being very conservative with his treatment. He missed an extended period of time for like quad tendinopathy when he was with the Spurs, and then he had this partial ACL, and he missed I think it was like 16 some months or something like that. I think he tried to do it conservatively, didn't do so well, and then he ended up getting the surgery, had to do the whole surgery kind of all over again.
Yeah.
And then he missed all that, I think it was 2022 season or whatever the case was, and now he's just in and out. It's inflamed. It's just not a good look for a premier basketball athlete.
$162 million contract.
Going back to PRP. PRP might be beneficial for him. They're using it more and more for intra-articular knee pain, for arthritic conditions, and for meniscal tearing.
Yeah. It's pretty common for, recurrent or, refractory effusions after surgeries and things like that.
And then, is this the road that we're seeing Embiid start to head down? Like
the degenerative road?
Yeah.
Absolutely.
Yeah, it's got to be, right? And I think in comparison of Kawhi and Joel Embiid, I think Joel's worse off because he's bigger, he's heavier, he's longer leverage, bigger bones, just way more force going through that knee than someone like Kawhi Leonard. And to the Clippers' extent, I guess Kawhi Leonard isn't the only guy. Whereas,
did you see Harden in that last game? When he's on, he's still he's savage.
He still has those moments, right?
Right.
Just couldn't put it together long enough for the Sixers to keep him too long.
The problem is that Embiid does things that a guy his size
should not
be able to do, and his body's just not meant to do that. I mean, there's reason that most 7-foot-plus guys don't do it.
Yeah, that's
Sean
fair.
Bradley.
Yeah, I mean Greg Oden. Right?
Yeah.
You got one injury into that knee coming out of college, and he was done.
Was it his knee? Or was he this?
Yeah, he had microfracture in his knee.
That's what it was.
Only works in Colorado.
Microfracture, classic problem for athletes return to sport, right? We used to do those. We used to think they maybe grew in some fibrocartilage, and it showed that, after long-term studies were done on those, that they had a very poor return to sport.
Unless it was done in Colorado.
Right. Of course.
It was done in Colorado, it worked.
Very specific
Right.
literature outcomes there.
Interesting. Well, gentlemen.
I just got here. Let's talk a little bit more. So I want to make a comment. Matt's not here right now, but when I got here, this headset was at least twice the size of my head. And it was dripping wet.
He got nervous. We put him on blast first. So
Thanks, Matt.
Yeah.
we hit him rapid fire with a bunch of stuff.
Above the mid-shin questions, or?
No, we kept it below the
Kept
shin
it below
for him.
the shin?
We, kept him in his comfort zone, so he
That's
didn't
good.
get too worried.
That's good.
But he still, I guess he broke a sweat, so
Yeah.
got a little camera shy.
I'm kidding. You can finish.
I know.
Show number 100.
100 in the books.
Yeah.
Thanks for having
And
us.
I mean, we did some different things tonight. We had 6 total guests and speakers.
Yeah.
We had 4 microphones. We had alternating headphones and microphones and all kinds of different beers going. So thank you.
I was looking for the appropriate injury. I also want to get Jennings on here, Dr. Jennings, because he's been on like 100 shows too.
Yeah.
And like, I didn't come up with that in good hand.
We'll find a way.
Yeah.
We'll
We'll
find
get
a way
back.
for the next couple. And we already have some stuff that we talked about that we're looking to the next couple, maybe 100 episode 101 or other things that we'll be putting together soon.
Heck yeah.
Talking about the spine and some other stuff to give a little foreshadowing.
Good
preview.
ones on the horizon.
Good one. And I
Yeah,
have another one, and I'll
hopefully.
talk to you off air and show you a video of that I just found out today, which is pretty interesting. But before we go ahead and close out our tab for the 100th time, we want to give a quick shout out to our sponsors here, Neck of the Woods Brewing Company, serving us up the coldest beers all night. And again, quick reminder, Sourfest, May 18th, 2024. And Timber Rear Production helping us put this show together over 100 times now. We're getting the video, the audio, and everything else. So we appreciate everyone who's been helping us, sponsoring us, and supporting us. And until next time, folks, we'll see you then. Thank you.